Good morning, everyone. My name is McDonald Metzger from the African Association of Disability and Self-Advocacy Organizations. Uh, we are doing a joint webinar today with our colleague Daniel Cheke, who's in Nairobi, Kenya, and Dr. Richard Oni, who's also here in the US. Um, and our colleague Whitney Terrell will also be adding on to this webinar. So basically, the focus of this webinar today is really to talk through what are people's rights during this global pandemic, and also what is your responsibilities as a person with a disability. How can you protect yourself? How can you keep yourself safe? And how can you keep others safe? And how can your family and friends support you? What can they do to really help out? Um, what supports are available from governments, or how should governments be supporting people with these disabilities during this global pandemic? And also accessibility, like you know, how can we ensure that the information is accessible to you? How can we ensure that there are people who are trained sign language interpreters who are interpreting some of the information that you're getting? The leaflets, how can we ensure that the awareness messages, how can we ensure that it is in different languages uh, so that you can understand what's going on so you can protect yourself. And for people who are blind, or how can we ensure that government provide information in braille or in alternative forms so that you can know how to protect yourself? And also just about getting help when you need it. There are countries who have set up hotlines that people can call in and get help. So I will allow go to Dr. Oni to introduce himself. Dr. Oni.
Yeah, good morning. I'm happy to be part of this morning session. My name is Dr. Richard One, originally from Nigeria, but based in Minnesota. And I'm happy that what we are talking about this morning is something that has been under expected, in the sense that when things like this happen, people with disabilities seem to be on the back burner because we do not see them as, people that we can really say. Sometimes we dismiss the idea that they don't even understand what is going on. And so for that reason, nobody pay attention. I have been in the field for several years, and I'm happy that this has become a new thing that we need to take action about. So nothing much to talk about that, to just listen to see how we can have this dialogue and make it very user-friendly for people that may listen to it. Thank you.
Right. Thank you very much, Dr. Oni. Daniel?
And my name is Daniel Chege. I'm in Nairobi. I'm excited to join you. Here it's already evening. This discussion is very important to us as Africans. We are almost getting a lockdown in many states, in many countries right now. Uh, and for persons with disability, it has a very huge impact. These are people who have depended on other people maybe to pull their wheelchairs, because most of them, they don't have motorized wheelchairs. So these are also people who do not have accessible materials. I have a very serious case where our police are now enforcing a curfew from 19 hours, uh, and because they could not. There is a deaf person in Busia, Kenya, who was clobbered by the police because he could not understand that there is a curfew, and he was found outside.
Hmm.
sorry, someone just called in. So this is a person who is deaf. He cannot hear. He may not even be able to communicate to police in the right language, and so police are enforcing a curfew, and they just get him clobbered very badly. So it's a very important discussion. We have very severe cases here in Africa and in Kenya, and I'm excited to be part of this discussion.
Great, great. Thank you very much, Daniel, for that point. I actually want us to dig more into that later on during our discussion here, because it is very, very important that we have this conversation about law enforcement, especially in Africa, and having them, and understanding what they know about, you know, talking to people, or engaging people who are hard of hearing. So it is a very good discussion that we should be having. But just before we even dig deeper into this conversation, let's start with what are people's right during this coronavirus global pandemic. What are people with disabilities right? First, one of the first right I will actually say is they have a right to accessible information about the virus, and how they can protect themselves and their families. Uh, because if you don't have information that is accessible, you won't know what to do. Excuse me. And in the case of the person you spoke about, Daniel, in Nairobi, the person who was hard of hearing or deaf, and the police is they have this lockdown, and they're telling people not to be on the street. If that information was accessible to the person who got clubbed, I'm sure they won't have been on the street, because they would have been aware, or even if the police have someone who could use sign language, or could communicate to that person in a way that they can understand. Uh, and it also goes back to training. How much training does our police forces in Africa have about supporting people with disabilities? Because these are things the police should be aware of in order to protect everyone, not just people without disabilities, not just people who can hear, not just people who can see. Because people with disabilities are citizens. There are people. But if we are making these emergency plans, or emergency responses, and we're not considering the rights of people with disabilities, then we are ourselves violating their rights, their human rights. And also, another point that we like to add here is that another right is people have a right to get the right support and services to stay at home during these lockdowns, so that they can keep themselves and others safe. And those supports can be like small grants that some countries are giving out grants, to people with disabilities, to their citizens, so that if you're staying at home, the source of income you had previously, that you're not going out to look for food, for money before, now you can stay home, and government can give you some whether it's a food shelf, or like a food handout, like a food package that can keep you going, or money that can help you buy groceries while you stay at home. But for people with disabilities, a lot of people go out during the day to look for money, but a lot of them don't have paid jobs. A lot of them, have to sell small produce, or market, so that they can, feed themselves and their families. And for people with disabilities who are renting, if they don't have a job no more, if they can go out no more, how do they pay their rent? So those are things that government, whether it's local government, whether it's national government, these are things that the government should really be helping out with. So I'll go over to Dr. Oni and see um, uh, what he has to add to that. Dr. Oni?
Well, I think you really cover a lot of this, even though, even in America here, we still have people who advocate for people with disability. And this is lacking in a lot of our African countries.
Mm-hmm.
And when we do have people that can advocate, they may not get the support that they need from the populace. And
Right.
if you don't have that support, you become a lonely ranger, and then people give up.
Right.
And that was one of the things I mentioned last time. There are various types of disability. We may be looking at intellectual disability, but there
Mm-hmm.
are also physical disability from what we just heard from our friend over there from Kenya. That's
Mm-hmm.
a form of physical disability when they cannot even navigate themselves
Mm-hmm.
from being home. So that's part of the issue we're dealing with there, to look at both intellectual and physical.
Mm-hmm.
Because when that happens, they were not able to move around, and they need to train the police to understand. Even in America, there are different ways we are teaching the police on how to handle people with mental illness,
Mm-hmm.
because sometimes that get into trouble because the police didn't know that they have mental illness, and they treat them like any other citizen,
Right.
whereas they have a disability of mental illness.
Mm-hmm.
So that's going to be big work for us when we talk about this right, because people write them off
Right.
just because of those area of disability. They
Mm-hmm.
get written off by the community and by the people that are supposed to really give them this opportunity of their right. They don't see them as having a right. If they cannot contribute to the community economy sometimes, those are the kind of thing people look and evaluate people with disability. It's like, what can they contribute? If you cannot do this as far as the African government is concerned, they are put in the back burner.
Right.
So I'm glad we are looking at this right, and hopefully we can enforce that and advocate for more of their rights.
Mm-hmm. Daniel?
Yeah, thank you very much, Dr. Oni. That is very insightful. You just look like you have seen our cases here. And to add on to that is to think about um, the people who take care of these persons who have disability, the caregivers. And in this case, I have in mind children who have severe disabilities, and the parents are they are supposed to be at home looking after them, because we do not have a system of care providers. So think of that parent who is now giving care to this person, and at this time she or he is supposed to be out there looking for food. There's a lot of limitations right now in Kenya, in Nairobi, in Africa. People
Mm-hmm.
are working lesser hours because the curfew is lifted from early morning around 6 hours in the
Mm-hmm.
morning, and by 19 hours you have to be in the house. So they do not have a lot of time to look for food, a lot of time to support this person. They have to be left alone. I have a case recently of a child with severe CP, cerebral palsy, who is always left alone from morning to evening when the mother comes back to the house. So even access to toiletries and food during the day is a very desperate case. So it is the issue. Sorry, I think I will have to put this on.
All right. So while we wait for Daniel to reconnect from Nairobi, the situation he was just talking about there, but this child, her parent have to go out with to look for food. Always, like we say in Africa, to go out and hustle, and come home late in the evening, and bring whatever that parent can find so that this child can eat. But then, who's looking after this child when the parent goes out? who's home to really look after them. And it's that parent getting exposed to something else, putting themselves at risk out there because they have to go out and look for food by any means to be able to come back home and provide something for that child. So it is really a very risky situation for the parent and the child. 'Cause basically, um, when you leave the child home when nobody's looking after them, that's a neglectful situation. But sometimes these parents too do not have, you know, people around who can help out. They have to do what they have to do, but they're also putting the child at risk. Daniel, I will come back to you there. So I know you got disconnected earlier. Daniel, did you get that?
Yes, I got that. Sorry, I got disconnected earlier. Can you hear me now?
Yes, we can.
Yeah.
Okay. So the other scenario I would want to paint to you is this person who is on the streets.
Mm-hmm.
He lives on handouts. He has a ball or something where people give him several coins.
Mm-hmm.
These people, they are exposed. They are out there interacting with the masses, with populations, and they target where there is flow of persons so that they can at least get more people giving them money.
Mm-hmm.
Uh, Look at that person. Look at the level of exposure to the risk of COVID-19. I feel if this person had another way of earning his living, he would not be on the streets looking for handouts.
Right. But
Yeah.
more so even during this time of need for everyone, if governments and local governments, city councils, nonprofit organizations were all coming together and combining resources to help people and really discourage people from going out on the street to beg, and putting themselves and their children at risk or themselves and their families at risk, I think it is very important.
I agree.
All right. So let's talk a little bit about people's responsibility too. Because we have rights, but those rights also come with some amount of responsibility. It's our right to get all of these basic social services and amenities from our local governments, from our national governments, especially in situations where they have declared a national emergency or we are on lockdown, we are at home. Uh, but also, how can we protect ourselves? What is our own responsibility? And that first responsibility that we have is really to ourselves. That first responsibility is to protect yourself as a person with disability. Uh, what are you going to do to make sure that uh, you are safe? So self-care should be prioritized at all times. You have a responsibility to keep yourself and your family members and friends safe. You can do this by following all of the measures that have been outlined, and we will show some of that quickly here by the World Health Organization on how to keep yourself safe. For example, using the mask if you are feeling sick and have a cough or a fever, hand washing, social distancing, quarantine, and hopefully there's a more simple way to say that: stay at home or self-isolating yourself. Uh, uh, so whether it's a government center that government has identified for people who feel that they're sick or you have been tested positive with the virus, even when you're there, you still have to protect yourself. You still have to cover your cough. Or when you sneeze into your elbow, or when they cough into your elbow, making sure that you're not, reinfecting other people or getting other people sick. Um, Globally, there are more than 1 billion people, roughly 15% of the world population, who live with disability. So you're not the only person who's going through this, who's struggling. There are people, more than 1 billion people all over the world. Since this is a global pandemic, There are people with disabilities struggling all over the world. So, but your responsibility really is to protect yourself and your family. I'll go back to Dr. Odi if he wants to add to this. Dr.
Well,
Odi?
yeah, I agree with you that, as a caregiver, we also need to care for ourselves. Otherwise, we will not be able to care for other people.
Mm,
And it is important in our field of mental health. We say therapists need to take care of themselves before they can work with their clients. One other area sometimes that happen is we we professionals, either direct care service or administration, we get so caught up thinking we have to save the world.
mm,
And in the process of doing that, we get ourselves in a bind that we're unable to help others. I was presenting something to teachers conference a few months ago, and these are the teachers that work with kids who have some other type of mental well-being. And I said to them, and the topic was on trauma. And I said, when kids in the classroom are traumatized, so also the teachers are traumatized
right.
because they are looking at how can they help those kids to the point where they become professionally traumatized.
Hmm.
So we caregivers sometimes we need to know when we need to take a break, and sometimes it is important that we take a break and let somebody else help us here and there, uh,
Right.
so that we are not overly committed to the level where it becomes counterproductive.
Hmm.
So I think that's just what I want to advise.
Hmm. And from what I heard you say, really, just to add to that, what I heard you say is really for people who are taking care of other people. So if it's a family member who's taking care of a person with disability, or a paid staff who's taking care of a person with disability, you also have a responsibility to keep yourself safe, but more so also keeping the person that you provide care for safe, and ensuring that you're not exposing yourself to situations where you might be able to get the virus and then bring it home to the person you support, and they also become infected. So it is really important that we are careful about not exposing ourselves to the coronavirus. And when we come to the people we support, either we make sure that we either cover our nose and our mouth, wash our hands, and make sure that we keep those people safe. Daniel.
Yes, I like the idea of you come first. You need to be healthy, even as
Mhm,
a person who has disability, so
mhm,
that the other persons who are interacting with you get help. They keep safe. And just looking at it from our context,
mhm,
where we do not have the provider's concept as it is in the US, or a paid caregiver,
mhm.
but most of the care is given from your extended family.
Right.
So there is a huge need to protect the people you love, and the only way to protect them is to keep yourself safe first, so that everyone else observes the guidelines given. And I'm happy, like you mentioned, there is a lot of information there. um, there is a lot of information customized in every ethnic language. I think right now I can comfortably say the information from WHO is accessible even through my local dialect, and I hope that everyone else can be able to access it through the local radios that speak that very basic ethnic language. They keep on updating this information, and this is information, if adhered to, is sufficient to keep people safe. If people observe distance, if people wash their hands, if people do the right things the right way. However, having taking care from an extended family in Africa, where we care for our old people. And in this case, we say that the older people are more prone to coronavirus than any other person, and people who have other healthy issues, immunocompromised persons. It's important to note that even in our interactions out there, if we have to go to work, at the end of the day, we will end up going home to the people we love the most.
Right.
And if everybody thinks about that, then they should be very careful even at work.
True. True. And you know, this is the situation of Kenya you're discussing here. That in Kenya, basically, the government, well, you didn't mention government, but I would assume it's the government who's doing that. They have ensured that information on the coronavirus is made available through the local dialects in the rural areas on radio stations, so that people get this information in their local languages or tribes. But what about for a person who is hard of hearing? What about for a person who who is deaf? Is are, are they making information accessible as well for those people? Is that
Well,
something you are aware of?
I have seen sign language interpreters,
Hmm.
but I have not accessed. I don't know if this information is accessible in Braille
Hmm.
or any other accessible model. But for sign language interpreters, I have seen a lot of effort, even to interpret local news into sign language. So there's a lot of effort into that, but I do not know the other modes of accessibility.
Hmm. All right. Thanks for sharing that, Daniel. Now let's go. Let's look at some of the World Health Organization recommendations on what people can do uh, to stay safe. And then I'm going to come back to um, I saw a picture recently on Twitter actually about a person with disability, sitting in a wheelchair, and they had this public hand washing station that was placed way above the person, and they were really struggling to get their hand over it to wash their hands. And that's also accessibility that we're talking about. But let's look at some of the recommendations from the World Health Organization. The first thing is, you know, wash your hands. Wash your hands with soap and water uh, when your hands are visibly dirty. And even if your hands are not visibly dirty, but it is good to wash your hand frequently, or you can use a hand sanitizer, an alcohol-based hand sanitizer, or you can use soap and water to wash, to make sure your hand is clean. Another thing is, after wash your hands after coughing or sneezing, when caring for a person who's sick, before, during, and after you prepare food, before eating, after you go to the toilet, uh, you know, when you care for animals or clean animal waste. For those of you, who have chickens and cows that you raise out there, make sure that when you care for those animals, that you also washing your hands. Um, Two things come up from this for people with disabilities in Africa. Um, do people have access to basic things like soap, like hand sanitizers? Uh, how are we making sure that people have access to these basic necessities so that they can stay safe? Uh, Dr. Omi, how do you think our local governments can support people to make sure that at least they have access to alcohol-based hand sanitizers, especially if people are going to be struggling to use a public hand washing station. And for most homes, especially in rural areas, people do not have running water. It's not like you're going to put your hand under a tap water and the water flow People have a bucket, go and get water from the stream. I know in my mother's village, there's a stream running. There's just water running through the forest, and people just go with a bucket and pick and get some of that water, put it on their head, and come home. It's not a situation. So who's going to actually pour water into your hand and you wash your hand? So these are all situations that people with disabilities have to navigate in order to stay safe. If I'm exposed to the virus, if I have it on my hand and I have a child who's at home and I call them and say, oh, here's the cup, pour water into my hand, and my hand is soiled, it's dirty already, and I hand that cup to the child takes the water in the cup, pour it in my hand, and then that child doesn't wash their hand. And then they go and touch something else. And I leave, my hand is clean, and I go and touch that same thing. We are just exposing ourselves to the virus. What are your thoughts?
Mm. Well, I mean, it is not easy. Um, it's not easy solution to those things. Um, there are so many barriers that people with disability are going through, especially
Mm-hmm.
in Africa, and especially even in America when the ADA came about, as to say, which is the act.
Mm-hmm.
If with many
Americans with
African,
Disability Act, yeah.
right, many Africans don't have that disability act,
Mm-hmm.
and so it's like no template for them to really follow.
Right,
Some may have it on paper, but not in practice. And a lot of those, we have it in Africa, but we're not practicing them. So how do the government need to either set up a specific area, just like we have handicap parking,
mm-hmm.
whereby some of those equipment recommendation can be applied to say certain area will be designated and no public can go there beside people with disability, so that will give them their own separate access, because a lot of time is the survival of the fittest,
Right,
and if you cannot struggle, you may not get what you need, even though it's your right,
right.
because you have this form of disability.
Mm-hmm.
So it is the government's responsibility to start thinking how we can set something aside for their right. It's their right to also have those things that is available to the public.
Mm-hmm.
Again, like we just mentioned, somebody placing equipment to a place where it's not accessible, and they will say, "Oh, we have it there." Well, you have it, but it's not equitably placed in a place where the person can access it.
Mm-hmm.
So they need some training. They need some ideas, and sometimes people do it unconsciously.
Right,
It's
right,
not really that they decide that this is what we want to do to people with disability, but sometimes it's limitation of their own knowledge.
right.
So we just have to continue. Like Brother Daniel over there is doing a great job, but it's going to require more outreach, more awareness, using even big microphone going around the community and villages and markets to really uh, do this awareness.
That requires a lot of resources from us to support Daniel to make that happen. Wow. Yeah. Daniel, what's your thought about the whole hand washing situation?
It is interesting that hand washing looks simple from the paper, but when you go to the actual hand washing, you realize the barriers, as Dr. Oni has just put it. Think of the people who live in slums. These are informal settlements and we have a lot of them in our towns, our urban centers, and water is in scarcity. They buy water. Uh, what will they use that water for? Is it for food or preparing food and bathing, or just pouring down? And the recommendation from WHO is run water.
Mm-hmm.
So
Running water,
if
yeah.
you go wasting, they will tell you are wasting water. So at the very best, they will put water in a basin
Mhm.
and everybody bathes from there. So this is not running water.
Right.
They're just being economical to that water, and for a very good reason. Uh, it's hard times economically, and this person has to buy that water, and there is no way he is going to use a whole half a liter or a liter just running to wash hands. Um, about the accessibility to soap, we can say relatively soap is cheap or affordable to every household,
Mhm.
but how many households can afford a sanitizer with the right recommendation of alcohol percentage? I
Mhm.
don't. I even in the local market, I am in Nairobi. I tried buying a hand sanitizer, and 150 ml is around $2. And $2 is someone's salary for a whole day.
Mhm.
How fast can I use that hand sanitizer? So it's all barriers, and they are compounded by the economic situations of our people,
Mm-hmm.
and that can be very expensive to some families. About again, washing hands in the villages looks a bit uh, easy. I had to contact my mother from the village and ask her how they are managing their hand washing. But I don't know, our culture again, people have to shake hands as a matter of respect. So I don't know how many people they shake hands with unconsciously. And remember again, oh, we are not supposed to shake hands, and then you are in the farm, you are doing your farming, and you don't have to go back to the house where there is forcible water running again. You're in the it's whole complicated
It is very.
issue for me to think about how they are managing. But running water is scarce, and even in towns. But I have to give credit to the government again, because these are resources that the government, especially in Nairobi and the urban areas, the government said you do not ration water in this time,
Mhm.
and even you do not disconnect the water because of water bills until this pandemic is over. That was a very huge step by our government to make
Mhm.
sure, at least, even if there is no, you still have water bills, you still have your water running in the taps. That was a good action by the government. Thank you.
Mm-hmm.
And talking to government just before we finish the recommendation from the World Health Organization, talking about giving governments credit, I actually want to give the government of South Africa credit and commend them for giving out small loans or grants or cash assistance to people with disabilities and older adults. They're actually giving out cash assistance to people with disabilities and vulnerable adults. And I know other countries are doing different things, but for those countries that are really trying to help its people, and especially people with disabilities, we want to say thank you. That is commendable. That is what you should be doing. And that's how you keep your most vulnerable population safe. Let's look at other recommendations here quickly. The World Health Organization is also recommending that in order to protect other people from getting sick, and even yourself, when coughing and sneezing, you cover your mouth and nose, and you flex your elbow, or you use a tissue, and then you throw the tissue into a bin. Clean your hands with alcohol-based hand rub or soap and water after coughing and sneezing, and when caring for someone who's sick. Avoid close contact with other people uh, when you have a cough and fever, and avoid spitting in public. If you have, if you have a fever, cough, and difficulty breathing, seek medical care early and share previous travel history with your healthcare provider. Going back to what you said, Daniel, early, we all know in Africa our traditions. We meet people, we shake hands. We don't know whether that person, whether they've been coughing or sneezing. We meet someone on the street. We meet our friend who we haven't seen in a week because of the lockdown. We meet them somewhere at the store. We immediately want to go and embrace them, hug them, shake their hands, get really up close to them when we should be actually 6 feet away from them. Um, especially if they are showing signs of maybe a fever or coughing or sneezing. But sometimes you don't know. Someone might be coughing and sneezing, but they might just not be coughing the time you get to see them. So that is an added risk for people with disabilities and for all people who are out there. How can we address this when social distancing is not really happening because of our own traditional practices? Any of you can jump in.
Well, it's a multiple layers. For example, even people with disability also have other conditions,
Mm-hmm.
and those other conditions are not even being attended to, and now it's coupled with the viruses. So we can see that they are more even um, more their immune system may not be able to handle this.
Right.
And so for us, for the people over there and anywhere in the world, we need to take a look at even their previous condition, their health condition, and how we need to also cater for that, because we may cater for one thing that will result to another thing. And so the issue of meeting all these requirements is it's okay to do that, but we need to also take it's bigger than that. And until we're able to get into everybody's need in terms of previous illness and in addition to the current issues that is going on. And sometimes we're unable to separate that. And so the system need to take a look at people with disability and look at their complete health conditions before we are able to, so that we can understand them better and be able to provide services that will be more amenable to them.
Daniel?
Oh, thank you. I think on the same issue, we have to think of social distancing, uh, especially looking at what the government has done. Again, uh, we are people, especially in Africa, who believe in decent send-off during burials. And
Mm-hmm.
so maybe during a burial, you will attract a whole village so that they can come and give you a decent send-off. Recently, the government banned such burials and they limit them to a maximum of 15 persons to attend a burial. I think that is a very huge step because there is a lot of interactions in the village, and especially during burials, relatives will come from Nairobi. Nairobi have the highest numbers of cases. They will come from major towns just to bury their loved one, and bearing in mind that cremation is not done in Kenya. Okay, it's not commonly done in Kenya, so people still do the burials, and it's a huge ceremony. So social distancing, it has been, the government is trying to enforce that. However, still people get to interact. People are in a way dating. I'm looking at a group who are now youths and they are still dating, and someone is going to meet his loved one, and the culture is to hug them, try kiss them, all that. And I don't know what happens to them if youths feel invincible or something, because still do very they have very, I don't know what to call this behavior, but it's a risky behavior
Risky
anyway.
behavior, okay.
So yeah, it's a risky behavior. So I'm looking at them and wondering if the government is trying on its side to enforce social distance, but even if you're not meeting as a crowd, one person is enough to expose you.
Right.
And that person could be the person you are dating.
Mhm.
So it is a pull and push for us, and I don't know how you're managing that on the other side.
Let me just throw something there. Especially, I'm using Nigeria now as an example. There are some places there that so, even the way they build their houses, they are so congested, and to enforce social distancing sometimes because of the way the locations of the building to each other is very difficult.
Right.
And I think the same thing will happen with people with disability because they live at home. They don't have congregated residential program like in the US in a lot of places. And so um, sometimes it's difficult for the government too because of the way the buildings are set up. And as we all know, it's for relatives, but people take care of themselves by the relatives.
Right.
So to distance yourself from the person taking care of you sometimes, it's hard for people to understand that.
Right.
So that is where the education and awareness campaign will be on the high rates.
True, true, definitely. And coming from Liberia myself, I definitely agree. There are so many places in Monrovia where after the Civil War, a lot of people came from the rural areas and came to the city. So the city is just so congested and houses are just jam-packed, attached to each other. There are even houses that are built with roofing sheets
Mm-hmm.
that are attached to a concrete house or a concrete building, and people are just squatting. And people who live in those situations, you have three or four people sleeping into one bedroom. And if you have a child with a disability or a child with a mental illness or a child with an underlying health condition who live with you, or an adult who with an underlying health condition who already have another illness, and knowing that coronavirus uh, takes advantage of people who have existing health conditions
Mm-hmm.
already. If your immune system is weak already and the virus gets in your body, it's going to really do some bad things to you. And so in situations like that, it's really hard for parents to protect their children, for adults to keep themselves safe. Because if you have a person who's taking care of you in a very congested situation like that, or who's supporting you, whether it's a family member, whether it's a relative, it's going to be really hard to say, stay a safe distance away from me. Don't come close to me. I'm not going to shake hands. We are used to saying good morning to people when we wake up in the morning, and most times in our communities, we say good morning with a handshake. And those things are our traditional practices, our values. As Africans in most countries will practice that. But to be safe, we are all discouraging people to put aside some of those values now, just to keep yourselves safe. Thank you very much for your points. There are more ways here that we talk about how to keep yourself safe in addition to what we've just said. So don't do these things. No handshaking, no hugging, no fist bumps. I know the guys like Dana, you talk about youth and practicing risky behaviors. We're used to doing the fist bump, or hugging, or kissing, but those are things that we're actually discouraging people from doing. And instead, we want you can say hi, smile, do the elbow bump. I've seen people do that after getting off the plane. You can text, you can call, you can message the person, and especially for people with disabilities during this time, texting, calling, and messaging is very important. Because if you're in self-isolation, whether it's self-imposed or not, whether it's something the government just say, we're locking down the city, everybody stay home, we need to check on people with disabilities. And the best way we can do that, if they have cell phones, is to call them, is to text them, is to check in on them regularly. Because it can be depressing, even for people without disabilities. It is a very difficult thing to navigate.
Yeah.
Another thing is, how can your family and friends help? Like I said earlier, these are things they can do. They can stay in contact with you. So daily check-ins, virtual visits. So for example, most people have the Facebook Messenger that they can use. They have WhatsApp that you can use. You know, we also use in Africa to making food for our relatives and dropping it off. So you can cook for a person with disability, prepare food, put it in a plastic bag or any kind of bag, maybe drop it at their door, and they can come outside and pick it. So that's one way you can help. Or if you have basic supplies like soap, toothbrushes, whatever you think that person would need, um, as a means of helping them, you can put that in a bag and drop it at their dog. Or if they have a caregiver, you can give that to the person to hand it to them. Information sharing is another thing. Families and friends can share important information about announcements from government about the coronavirus. Like Daniel, when you mentioned earlier about that person who was hard of hearing, who the police clubbed, if a family member or friend knew where they were at the time and knew about the curfew, they could have shared that information with them in a way that they can understand, and that would have prevented them from getting hurt by the police. We cannot overemphasize the importance of social distancing. So if you're a family member or friend, if a family member or friend is sick or ill, you need to do what you can to stay away from that person. Protect yourself. You know, it's hard to do. It's hard to do if it's a loved one, your wife who's sick, and you guys live in the same house, sleep in the same bedroom. Maybe for a while, one of you can sleep in the living room, and one of you can sleep in the room. Again, I'm not saying this is easy to do, but these are just ways that we are recommended to keep yourself safe. And I'll go back to the two of you if there's something else you want to add to that.
I think you cover everything from that.
Daniel?
You sufficiently polished that. I am happy about that.
Okay, what about supports? We you've talked a little bit down there about supports that the government is offering in Nairobi. But what else can government really do? What else can our elected officials do? What have you is providing accurate information and education on how people can keep themselves and others safe, ensuring that the information and education they provide is accessible, um, and making use of a trained sign language interpreter. If they're providing that information using any form of media, say the TV, they can have a sign language interpreter speak. They can make the information available in Braille, and they can make it available in different dialects that people speak. Um,
Uh, I am thinking the reason why a person with disability would go out from the house at this very difficult time would would be very necessary. Maybe necessitated by lack of food
mhm,
or something very basic like medicine.
mhm,
So if I would recommend something from the government is to make sure that these people have food accessibility. I don't know how that model would work uh, because you cannot isolate one person in a household because he has a disability and just feed him. So if you have to feed a person with disability, you are feeding a whole household again.
mhm,
Uh, but ensuring that such a household has food would minimize the need for a person with disability to go out right now. And if there is any need for medication, uh, making sure that that medication is available even at the smallest unit, like a dispensary or a health unit. That would be very important. That would minimize the need to go out. I know it is very difficult right now to board matatu. You are aware about matatu. Maybe Dr. Oni is not. Matatu
Bosses.
is our
The,
buses, our mode of transport. Uh,
the Boda. I think in Nigeria it's called Boda. That,
Yes.
I don't know. That would be very difficult. It is right now. The government has reduced the number of people who should board a matatu or a bus at one given time. Culture is overcrowding a bus
and
so
that
that
means
you
the
can
price, the
maximize.
transportation cost is going to go up when the Matatu drivers cut down the number of passengers. The cost of transportation is really going to just soar.
Exactly. Now there's a joke in Kenya that you pay for yourself and you pay for corona. So you're paying for two seats, one for yourself and one for the corona disease.
Oh my goodness.
Oh yeah. So you pay double. That is it. So for a person with disability to move from the house with all these inconveniences, it means it's very important for him to go out. So that could be food, that could be medication, that could be basic necessities which could be provided for this person and to keep him safe at home.
Thank you very much for bringing that point up, Daniel. Dr. Omi, what
Yes.
else can government do to support people with disabilities during this global pandemic?
But just like I mentioned earlier, that the government need to at least look at the people with disabilities issue as very unique to them and provide the unique services, such as, like I said, designating certain services in a location that is accessible to them. So that way, the competition between the public and people with disability will be minimized because people will regard it as, hey, this is for people with disability and we cannot go there. I know it may sound very,
Segregatory?
yes, for other people, but this has to happen, regardless of how people view it.
Well, the coronavirus right now doesn't promote inclusion, even for people without disability. Like all of us, we have to isolate ourselves. So
So
we cannot apply inclusion in this setting.
exactly. So the services have to be uniquely set up for them and make it accessible based on their need. The government also need to do more of this education of the public. And like you rightly said, I said there need to be some models, some different way of letting people know the seriousness of this virus. And the government need to set aside, even like we said, the distancing is okay, but when people are distanced and said and be isolated, what can we do to engage them there in that isolation? Over here in US, even people with no disability, everybody have some form of disability anyway. But
Well, yeah, everybody have some.
but people here, they are able to pack food and keep in the home.
True,
Over there, they need to find a place where people can eat.
true,
Even if it's just serving it and people picking it up, or people delivering it to the houses, because that will minimize. If you say don't do this, but nothing to replace that, people will not follow the rule.
true.
And so I think that is what the government need to look at. When they make laws, they need to see the gap. Why would people not follow this rule? It's because of their need that had not been met. And so the government need to review those that would take the issues of people with disability with the government. So
True.
they need to police each other there.
True. Thank you very much. That's a very, very, very good point. There's so much the government can do to ensure that people are safe. And when I talked about inclusion, actually earlier I meant integration of people within the community because we've always been talking about community integration and not excluding people from the community. But during this time, really, as a community, we have to also protect people with disabilities and ourselves. So. Stay away, stay home, and not expose yourself to getting infected by the virus. We have talked over and over and over and over about the importance of accessibility for people with disabilities during this virus, because during this pandemic, because accessibility is really important for all people, including people with disabilities. We suggest a national hotline should be set up so people with disabilities can call in and get help. For people who do not have food or need some basic supplies for themselves, since they cannot go out, can they call a hotline and someone from the government or social services can come to their home and bring them something? If there's an emergency, who do they call? There should be a hotline with text capability so that you can actually text the line. If I cannot call, I text. And for people who have cell phones, people with disability who have cell phones, I know in some countries, the cell phone agencies or companies are giving out free credits that allows them to call during emergencies or open phone lines so that they can call or text their family members to check in on them. Information on prevention and awareness should be made available in plain language and in many different formats. TV stations should consider hiring the help of a skilled sign language interpreter. Social service agencies, provider agencies, and community-based organizations should consider creating their own outreach and awareness campaigns locally. They can create flyers in different languages using different images, etc., to really help people understand what's going on and how they can protect themselves. Lastly, get help. We cannot again overemphasize the importance of seeking help, and that's why I spoke about the hotline earlier. Government should set up a hotline, so don't be afraid to get help when you need it. If you're sick, you think that you're sick, or someone else close to you is sick, call another family member or friend and get help. Call the hotlines in some countries that these hotlines are available. Call the hotline, call a family member or friend or relative. Manage your time on social media, and I'm talking about that because myself sometimes I get overwhelmed with social media, with all of the information that just pour in. There's no way of really filtering some of that information. I've heard all kinds of information. People send me audio messages from Africa and other places around the world every day about conspiracy theories about where the virus is coming from and what it can do. People are saying, do not take vaccination, do not take any medication. I even saw a video that someone said, do not use the face masks because someone infected the face mask with coronavirus. And so when you put it on your face, you get the virus. So manage your time on social media, practice mindfulness. If you're a person who knows how to practice meditation, there are free resources on YouTube if you have access to YouTube on how to practice mindfulness. But take care of yourself. That's the most important thing. Any final thoughts from the two of you before we close?
Well, I think we just need to continue. If we have contact in Africa, maybe we can also share knowledge from here with them, like our brother Daniel over there, that is really doing a lot of work there. And we see your frustration sometimes because we've been there, we were there. I mean, so it's not easy. And there's a saying that it's easier to say than done. The government, we voted them in, and we just need to hold them accountable as well to not leave anybody uncared for. People with disability need to be careful. And so they have to be part of the priority too. So that's what I just need to add.
Thank you very much, Dr. One. Daniel?
I want to thank you for this insight and thanks for understanding what we are going through here. It's a difficult time for everyone in the world, but more especially for the people who are in developing world. I understand policies can be very huge. Policies speak volumes for our government, but implementation sometimes is zero. So we hope that people can do what they're supposed to do and put themselves first and keep safe.
Mhm. Thank you very much. I don't know who else is on the call, but whoever that was, we want to say thanks for joining us. Um, this discussion is really important to us as an organization, ensuring that people with disabilities are safe, that they are getting the needed services and supports to stay alive and protect their families as well from the virus. Um, uh, we want to thank all of our friends, our colleague Whitney Terrell, who will be making another version of this video, the webinar, and that will also be made available online. But I want to thank both of you, Daniel and Dr. Oni, for making time this morning and evening or afternoon in Nairobi, so that we can talk about how people with disabilities in Africa can really stay safe during this global pandemic. It is very scary. It is very scary for all of us. And if you think about it, people are dying. So the virus is real. It is not. It is not fake. It is not. It is real. So be aware of it, and protect yourself. So, on behalf of the African Association of Disability and Self-Advocacy Organizations, we want to say stay safe out there and stay alive. Thank you.